would it be more advisable to undergo a root canal procedure or to have a tooth extracted and replaced with an implant?
So the question is, would it be advisable to do a root canal or remove the tooth and be done with it and replace it with a dental implant? So as a dentist and as a dental specialist, I'm here to give options to my patient. We do not do any treatment without giving them options to the patient. So if you have a smaller cavity that requires a root canal, and my recommendation would be that to strongly consider doing a root canal treatment. That's going to be the least expensive option, and I'm not going to say just for a smaller cavity, oh, remove the tooth and be done with it. As opposed to on the same on a patient, let's say that a patient had some complications on the previous root canal they may have had, or they had a previous root canal that failed within like 2 months after. They are going to say that, hey, even though it is a smaller cavity which is going to require a root canal, they are going to say, hey, I don't believe in root canal and I don't want to do this and I want to get the tooth and done with, or I don't have the money to do the root canal then, and we don't have an option to do other than removing the tooth. However, having said that, removing the tooth just because you need a root canal and replace it with the dental implant, I do not recommend that. You evaluate your options and you understand the risk and complications and the pros and cons of removing the tooth and do an implant as opposed to doing a root canal, and then your dentist will be the best person to address that. For example, whether it is a first time root canal or whether it is a second time root canal, whether you have the right bone, whether you do have an abscess which is along with a root canal you're going to require. So there are multiple factors which are going to help you decide whether it is just a simple root canal or you're going to need extensive treatment after this root canal tooth to be removed to replace the tooth. So your dentist will be the best option, and if you happen to be in the Dallas-Fort Worth area, come see us and we are happy to help you. Absolutely, yeah.
Okay.